you a golfer, a tennis player, a pickleballer with elbow pain on the inside or outside after your sport? I'm Dr. Steve Brown at Boulder Sports Chiropractic. In this video, I'm going to show you a few tips and tricks on how to help decrease some of that. When we have the medial or lateral epicondylitis, often there's a lot of tightness in the forearm muscles. So what we're going to have you do as your first exercise is try using a tennis ball, lacrosse ball, dog toy ball, whatever you got that's round and firm. And what you're going to do is set your forearm down on your leg. You're going to use your other hand to kind of compress that ball down into the forearm, and you're going to do a little bit of seek and destroy. Now I'm scanning through and I'm looking for that tenderness. Okay, there's a good spot. Then I'm going to hold some pressure there as I open and close my fist or move my wrist back and forth. We'd repeat that same thing if we were talking about the outside. And so again, you're just scanning through, you find a spot, hold it, do some wrist motion, open and close the fist, and then you just kind of work that upper 2/3 of the forearm. Now we can also use a different tool, something called an R8, and effectively this is just a spring-loaded tool where I can actually put my forearm inside of it, and then this thing is applying the pressure for me. And again, I repeat that same of doing some circles or some hand motions once I find a good spot. The last thing to talk about is something called the counterforce strap. So effectively, these straps have a hard little piece on the inside, and the purpose of that is to take pressure off that attachment point. Now with either of these medial or lateral or golfer's or tennis elbow, the big problem is all of those muscles start at one common tendon on the inside or one common tendon on the outside, and then they come down. Now all those little muscles that control finger or wrist motion are all pulling on that same spot. So when they get super tight and overused, what's happening is they're just repetitively pulling away from that attachment site. So with your counterforce strap, you effectively slide this on and then really cinch it down so that hard little part is pushing into the tendon. And you're going to do that just down from that attachment site, and then that in turn will take some of the pressure off that attachment site, because now you've almost created a new attachment site kind of thing here. And so you do that either on the inside or the outside, depending on which one you're feeling. And this just helps to take some of that pressure off. Now it's not going to fix anything, but it will help decrease more irritation from happening. So if we wanted to fix things, then we need to get into some exercises. Easiest exercises, we're going to use a small dumbbell. You can start as easy as like a can of soup. I have a little 8-pound dumbbell, but again, doesn't matter where you start. The idea is we need to actually strengthen that tendon a little bit. So what we're going to do is go back to that position of resting our forearm on our leg, so make sure that elbow is supported. And then we want to, if we're working that inside, we want to start with our elbow or our wrist kind of flexed. We're going to put that weight in there, and then you're slowly just going to let it out and control that eccentric descent down. And then I'm going to pick it back up with a good hand and slowly work down. Now this is the same if I were working the backside. Again, I'm going to come into that position first. With the good hand, I give it to the bad hand, and we slowly control it down. Then we can also work on some rotational stuff. Just nice and easy working back and forth through there. So these are just some exercises to get you started. Now if you've tried these exercises and you're still experiencing some of that discomfort, come on into Boulder Sports Chiropractic. We've got a number of different treatment options that we can do to help actually get in there and break some of that stuff up and decrease that pain.